A stroke is something that happens generally suddenly, and that's why the word stroke came into being, because somebody is struck down. So that's where the word stroke comes from. If a person is restricted in bed because they've had a weakness on one side of the body and they can't walk, can't move, they're in danger of having complications because of that. They can have clots in the legs and clots can go to the lungs. They can have bed sores develop. They can have problems with their swallowing, and if they don't have that addressed, they can put their food down the wrong pathway and can go into the lungs and they get pneumonia. So these are the complications that we want to avoid. And so when we admit the person to the hospital, these are the things on the stroke pathway that we want to major on. So that it's preventing complications. We also want to prevent further strokes, because once a person has had one stroke, they are at increased danger of having a second stroke. For instance, with a TIA, a transient ischemic attack, they're in danger of having a stroke, a major stroke, within a few days, depending on certain risk factors. So we want to prevent that sort of thing happening. Also, as soon as possible, we want to start rehabilitation. We want them to start thinking, start doing the things that they're going to have to do as much as they can. And so even in the acute stage, in the first few days, we're wanting to get people up out of bed if we can and get them mobilising and getting as much function as we can. And that's going to make them eventually